Children's Safety Network, a programme from Education Development Centre, or EDC, works with state and jurisdiction health departments to prevent injuries and violence. Our reporter Diane Easterbrook went to see how.
In the U.S., nearly 14,000 children and adolescents aged 0 to 19 years old die of injuries. Another 227,000 are hospitalized, and 8.7 million visit the emergency department for treatment of non-fatal injury. Children's Safety Network, a program of Education Development Center, or EDC, works with state and jurisdiction health departments to prevent injuries and violence in this population.
Education Development Center is working to improve health, education, and economic opportunities across the lifespan. Some of the key projects that they're focusing on are STEM, education, early childhood, and suicide prevention. The Children's Safety Network is the program that I'm the director of, and that is a national resource center for the prevention of injury and violence among 0 to 19-year-olds in the United States. And CSN is funded by the Health Resources and Services Administration, Maternal and Child Health Bureau of the U.S. Department of Health and Human Services. And as a national resource center, our primary stakeholder group are the state and jurisdiction health departments. And we offer a number of resources and training and technical assistance, such as educational webinars, a collaborative which we take our states and jurisdictions through a quality improvement approach, and we ask them to work on systems improvements. We ask them to identify and widely disseminate best practices across a number of child safety topics. We also work with our partner organization, the Pacific Institute for Research and Evaluation, known as PIRE, and they help us to do some data analysis looking at national trends and then state trends across a number of child safety topics. And based on that, we coordinate with a group of child safety experts, and these experts come from across the nation, and we determine what are the high priority and the emerging issues that we should be facing each year.
We've worked with the Children's Safety Network for several years. We've been a part of their collaborative, and we've worked on several topics as part of that collaborative, including suicide prevention, teen motor vehicle crash prevention, and traumatic brain injury.
The Tennessee Department of Health is also collaborating with the Children's Safety Network, also known as CSN, on the Safe Stars Initiative. Safe Stars is a youth sports safety program where youth sports leagues across the country can receive a designation of bronze, silver, or gold, depending on the safety criteria they meet.
And we really want kids to be involved in sports because it's important for them to get that physical activity, but we want that activity to be safe.
Well, as the athletic training coordinator with Rutherford County Schools, a lot of the things that are required we were already doing. It was more of a scavenger hunt to find all those policies and procedures. So once we put them together, we realized that we qualified for the Gold Star level at all of our schools. Once we started really looking into it, we were glad we had these things because they were things you should already be doing, such as background checking your coaches, having coaches CPR and first aid certified, having an AED at all your practices and games, just things like that that should be done at all levels of all sports.
And we encourage all leagues to apply for this designation and strive to meet these minimum policies for the safety of their young athletes.
We think it's really important that our states and jurisdictions have access to child safety experts across a number of child safety topic areas, that they have the appropriate resources, such as identified best practices, programs that are cost effective, programs that have been evaluated, and that they have these tools available to them and they have people to speak with when they run into challenges. We encourage states and jurisdictions to come and visit our National Resource Center. We have a lot of information on our website, childrensafetynetwork.org, and we offer a learning collaborative, the Child Safety Learning Collaborative. There will be applications coming out soon, and we encourage all states to contact us and ask more questions about that.
With programs like the Children's Safety Network and initiatives like the Safe Stars Initiative, EDC wants to ensure that all children ages 0 to 19 years of age will stay safe and healthy. In Nashville, Tennessee, I'm Danella Seelock, Vanile.